So next we have Mustafa. Mustafa grew up in Kenya and came to Canada in 2007 as a sponsored refugee student on a World University Services Canada scholarship. He graduated from UBC in 2012 with a bachelor's degree in cognitive systems, a multidisciplinary undergraduate program involving 4 departments: computer science, linguistics, philosophy, and psychology. Internationally, Mustafa worked as an interpreter in Kenya for the United Nations and as a high school math teacher. In 2012, he started working for Diversity as a counselor for the Moving Ahead program serving Somali-speaking clients. He joined Fraser Health in June 2016 as a coordinator of language services, and his responsibilities include, among other things, policymaking, education, and quality improvement of language service processes at Fraser Health. So welcome, Mustafa. And I know this is a question that has come up a lot over the past year, is just around access to language services under Fraser Health. So we're really excited to have you and learn about this.
Well, thank you so much for having me. I know language service is one of the top questions that comes up whenever we're talking about access to care, whether it's a perceived lack of or lack of knowledge about the availability of the resource. So what I will do is I'll talk to you in a brief snapshot, the department I work at, the job we do, and I'll get into language services, the different types of language services, and I'll touch on a project that we're working on that addresses some of the challenges. So I work with the diversity services. The slides may have animations in them, so you have a bit of work. So diversity services previously started as a site-based service out of Surrey Memorial Hospital. And with the good work that they performed, given the fact that we have a large population of diverse people living in the Surrey region, it was made into a region-wide service in 2010 with few areas of focus. So our primary focus at this point are these key areas. One of them is cultural competency, training staff. We are generally a support service for staff. While we address the challenges from the community-based, we provide that feedback to staff to mitigate those challenges that are both at the community level, but at also the health authority level. So we do provide educational classes on culturally competent cares and how to provide culturally sensitive care to large population groups. We do also fund and provide language services, both translation and interpretation services, and I'll get a little more in detail coming up. We do provide input and also actually produce some policy work. We have 2 policy papers right now in the process. One is around language policy, and the other is diversity policy for Fraser Health. But we do provide input on accommodation, how to accommodate diverse people in some of our policy work. We do also engage with communities around services and programs and other areas of partnership. One of the key areas of partnership that we focus heavily is access issues for both immigrants, refugees, large community groups, subgroups, whether it's religious, cultural, LGBTQ, racialized, or individuals who are coming from any minority or marginalized population group. So let me walk you through, and just as a bragging right, this is the only health authority in the province that has a dedicated diversity service office of all the province. So Fraser Health is the largest health authority in the province, serving more than 1.7 million people in the large geographic area, starting from Barnaby to Hope. This includes over 20 municipalities, 12 hospitals, 1 outpatient center, an extensive network of health programs, including public health, residential care, assisted living, mental health and substance abuse, and other specialized programs. Why we do need the diversity services, it is, while the region is that large, we do have some areas that are, next slide, we do have some areas that have more diversity than others, but there are areas that have super diversity. So if you look at Barnaby, there is literal representation of every community, but not large enough to say this large community dominates in this space. However, if you come to Surrey, it's not the same. You would get one large homogeneous, diverse group feeding into that mosaic of what makes up Fraser Valley. So based on the municipality we are in and the demographics of that municipality, the programming around and the needs around that specific area would be quite different. One of the differences would be in the area of language services. So when we talk about language services, we're talking about two areas. One is translation services. We do provide translation service in-house to all our staff when it comes to written materials produced, for example, any public health materials that are produced that make part of what we call our patient education, we would translate them for department and we'll put them up on the catalog. There are a few processes that are in-house, but one of the challenges I have also noticed is while we provide this great service, something that needs to be taken into account is often the refugees and new immigrant communities that we serve do not speak or read or write they do speak. They don't read or write their own native languages. So we may have new beginnings for Arabic, but if someone doesn't read Arabic, then the education component doesn't replace the fact that you have a brochure. So that needs to be ongoing. The other one, which is the biggest one that I'm hearing, and I keep hearing whenever I engage with members, is the interpreter services. So Fraser Health does fund interpretation services for all Fraser Health employees in any Fraser Health operated or owned space, free of cost. Well, it's cost to us, but not to any of our departments. The service is provided through BLS in a partnership called the Lower Mainland Interpreter Services, which is the 4 health authorities coming together asking BLS to spearhead the provision, recruitment, retention, and dispatch of interpreters as needed. So there are different types of interpretation that we do receive. We have the remote interpreters, which is an interpreter not being in the presence of a patient and a healthcare provider interacting with one another. And we have face-to-face or on-site based interpretation. So the remote could be either a video conferencing or an audio. The good news with the audio, it's almost 24/7 available to all our staff wherever they may be in most languages. For face-to-face interpretation, it's available on demand, well, not on demand, on booking, based on the availability of interpreters and based on a number of other complex issues that need to be considered. But generally, we have been able to meet most of the needs of ask for professional interpreters coming in for interpretation services. There are a few challenges with it, but those challenges are challenges that we're working with. The reach, the effectiveness, and the efficiency of this service sometimes is a lot questioned, and rightly so. We are trying to improve on the quality, the effectiveness of these services by looking at other initiatives and better ways of providing the service as we keep going and evolving and the needs keep increasing. But also the other challenge is our continuum and the service scope is so limited only to Fraser Health staff. So I'm not able, sometimes we would be able to provide a care for you in a primary health unit, but if you're referred to a community or a GB or something like that, you won't have the interpretation available to you because they cost a lot, and Fraser Health is not in charge of folks that are outside the Fraser Health scope. There's no translation free for service translation at physician offices at this point because Fraser Health, again, is not in charge of physician offices. There is the challenge of not enough interpreters, and that's something with recruitment from BHSA that they keep ramping up and making sure that these are available. The challenge with that is there is not that many people who speak some special refugee languages that can serve all the needs of this vast region that we have. But the funding and all the challenges that are raised are something that we are aware of, and we work on daily and make sure that we improve on this. So the system level challenges are some of the things that we will have to keep working and making sure that they're available. However, some of the initiatives we're looking at right now is realizing that the logistics of having an in-person interpretation available all the time, especially on a short notice, is such a hectic. We're looking at maybe having video remote interpretation that meets the need for visual instructions that oftentimes comes up with face-to-face interpretation, but also is on demand. So you don't have to pre-book, you don't have to go through having someone dispatched to come around, but that we don't have. It's something we're looking into, and hopefully we will, if it's available to us through some of the technologies, that we would be able to harness. The question that often I face when I go out is, why do you provide language services? And this comes oftentimes for folks who either don't understand the need for it, or that have maybe that they see this is a misplaced resource. So the population density is one of our reasons. We have seen an increasing diversity of the Canadian population. 80 to 90%, it's said, that of the refugees eventually settle in the Fraser Valley region. So they would, in one way or another, come to a service that is provided by Fraser Health in that region. And nearly 3/4 of newcomers report English not as being their first language. So oftentimes when a person is in such an emotional distress, especially in acute care centers or when you're interacting with a healthcare provider, you resort to the language that you best feel comfortable in. And this is oftentimes your native language. Even if I'm a fluent English speaker, oftentimes when I'm under duress, I go back to my Somali language because that's where I feel most comfortable. Not always, but oftentimes. So we do understand there are situations where we would have to need these languages because that is, we want to meet the patients at their most comfortable space. Currently, I think there's no legal implications as far as language service for general public is concerned. There's no legal mandate for Fraser Health to provide language service to everyone, except for the deaf and hard of hearing community. If you have difficulty hearing or you're deaf, then it's mandatory to receive service not only in the healthcare space, even in social service, to receive ASL language, American Sign Language, as part of the care that you're being given. It's mandatory, at least in BC. For the rest, it's not, unlike the rest of the world. In New Zealand, Australia, and the US, it is. In Canada, it's not. But it's a best practice because when we talk about having informed consent from a patient and interacting, part of the word informed is that you have an adequate understanding of what you're signing off. And that is key to communication. So if I don't have the informed piece, then it implicitly becomes kind of a legal implication on you. So we do provide also around that issue. Currently, if you go to the next slide, we have grown in the last 7 years from a 25,000 hour service to almost 50,000 hours of service. And this is due in part to extensive knowledge about the availability of the resource, staff knowing that this is available to them, and also the increasing population in our region. And I think when you talk about languages that are the most used, Punjabi is our highest language used. About 48% of the services are utilized by Punjabi-speaking patients, and rightly so, specifically in the Suri region and Abbotsford region. Arabic is our second language at 20% almost usage. Mandarin continues slightly follow at about, between the two of them, 16% of usage, and Korean is our fifth language at 4.5. The rest fall as we go down, but we do provide in about 100 and so languages. So if I specifically focus, because of the Syrian refugee influx, on the Arabic usage alone, my next graph, you would see that last year we only received about 3,000, and this year we are projected to receive to about 7,500. That's more than, 3 times a jump? And this is just due to the influx of more refugees coming into our space and utilizing our services. So we are working to ramping up and making sure that enough Arabic interpreters are available to professionals as they go out and about providing services to our care team, to our population group. Now, the other question I normally get is, how do I access an interpreter as a settlement worker, either settlement worker or a patient coming to Fraser Health? Well, the service available to staff, so you cannot, as a settlement worker or a patient, call for an interpreter to come to your session, but you can inform, if they don't know, the healthcare provider that this is available. It's a matter of either picking up the phone and having an audio interpretation available to you on demand, or book an interpreter if you know in advance that the patient coming into your care has limited English proficiency. So book an interpreter before you even interact with them. So depending on the need, the complexity, the situation, the urgency, one way or one type or another of the interpreter format, the remote versus the face, would be dispatched or would be accessible to you. And to that regard, we have developed some language resources for our staff to use. This is one of the language resources, is the processes to identify and assess the patient language needs. How do I know what are some of the language needs? What are some of the pointers I need to look for? Or how do I identify the language that someone is speaking so that I can ask for the correct interpreter to come in? The other is instructions on how to access and arrange an interpreter is available resource. Sometimes we do provide education guidance on how to work effectively with an interpreter, because that is an art in and of itself. Oftentimes, one of the challenges is when you have a third person listening in, as a professional, there are concerns they have about the confidentiality, privacy, the ethics behind it. And those are the conversations that we have with staff, ensuring that these professionals have gone through a rigorous rigorous, I think, process vetting of making sure that they have the understanding of the code of ethics and that all conversations are kept confidential and private. We do also work beyond language services and also in conjunction with that through access issues. So when newcomers, immigrants, refugees arrive, they often have difficulty accessing health services, either because they either don't know about the service itself, it's brand new to them from cultural knowledge, or they have low English proficiency, they need language support. Sometimes they complain about, or they rightly don't have access to support, to transportation to and from the healthcare. Sometimes it's a lack of understanding of the Canadian culture, in quotes, of the Canadian healthcare system. What is the culture like? One of the questions that I think I normally hear is, well, I went to the doctor and he didn't touch me. I sort of feel my forehead for the fever or something. Oftentimes it's not the case that healthcares have to touch your body or anything of that sort, but that may be back home where you come from, that was a culture. So those are the Canadian culture first as well, the culture you're coming from, making sure that there's that understanding, that this is how we provide care while respectful of your traditions and beliefs. Sometimes stigma associated. There is some folks don't, especially relatively new and generally in the general public, don't talk about mental health issues, reproductive health issues, gender-based violences, and things that are normally stigmatized either culturally or societally. And then there are services that are not culturally sensitive, generally. So those are educations that we do. So to that effect, one thing hearing from folks, I want to talk about a specific project or a rather specific piece of that is ongoing. The project was how we as a health authority and in collaboration with the right partners, mostly immigrant serving organizations, can do a better job of helping newcomers to understand and access the healthcare system. In the past couple of years, the theme of newcomers needing more support to understand and access our service was coming up. We know that this is not new for those of you who work closely with people who are immigrants, refugees, and migrants. I'll often talk about orienting. We often talk about orienting in this brochure that I'll be discussing shortly, helping newcomers to understand the system such that they have a better sense theoretically of the system, but also that they can better use it when they need it in a way that's useful to them and appropriate. So based on that, we developed a guidebook, sort of, or what we call finding your way around our healthcare system to explain the different services that Fraser Health offers in an extremely clear, plain language, and accessible way, and in one form of a guidebook that we locally can only explain to you within Fraser Health. It will not tell you anything in general about Canada and the various forms. So I've been lucky to share out that document in its initial formats out with the community, some members in this community, and also through our healthcare providers to get initial feedback. And I'm more than happy to continue having that conversations with the consultant who is producing this document for us, and make sure that it becomes part of the education catalog material that is accessible to give out to communities to understand, and it explains in depth everything that you've been hearing today, how to get at the doctor, what are the services available, what are the numbers to call, when not to go to the ED, when to go to the ED, and all those sort of things. So with that, I think that's the end of what I wanted to talk to.
Great. Thanks, Mustafa.
You're welcome.